Chances are you aren't actually training your hips when you think you are. If you want to know the secret to make sure you're training exactly what you want, check out the next video.
Let's go.
My name is Dr. Moses Bernard, and I'm a chiropractor and functional range systems mobility specialist. I'm here at Criticalbench today talking about hip strength and mobility, but before we get started, I want you to check out the pinned comment below for the Bodyweight Beast program. Today we're going to be talking about hip extensors, making sure that you're training the things that you actually want to train. And to do that, today I'm going to have Coach Tonya helping me.
Hi.
And I've assessed Coach Tonya, and she came to me mentioning that she was having some back issues with some of her hip dominant exercises. So one of the things that we looked at was to see that she had the ability to extend her hips without her back compensating. So a lot of the times when people go to extend their hips, whether it's at the end of a deadlift or at the end of a squat, they can't quite finish the hip extension and then their back wants to compensate. And a lot of our hip dominant exercises, when you look at like kickbacks and things like that, you'll see my back can actually help out quite a bit. So there are some ways to take your back totally out of the picture and make sure it is your hips doing the job. So I'm going to have Coach Tonya go into a tabletop position. So she's going to be on her hands and knees. She's going to be facing away from me. Yep, perfect. And what I'm going to have her do is I'm going to have her kick her right leg straight back. So she's just going to be kicking her leg in the air and bring it back down. And in doing that, in this position, you can see her back is totally free to move. So if you do that again, so kick up, you can see that there can be movement in her low back. So she might be doing hip extension exercises, her glutes and her kickbacks and things like that, and not realizing that her back is helping. So a way to really take her back out of it is I'm going to have her slide her left leg forwards. She's going to collapse down to her elbows, and her right leg's going to slide straight back. And by coming all the way down into this position, by having her chest glued to her thigh, that ensures that her back cannot help her. So now from this position, if I asked her to try to lift her hip from here, she has a really hard time doing it. And this is the case for a whole lot of people. So in this position with the chest touching the thigh, hip can't help, or hip can't work because the back isn't helping. Back in the full tabletop position, it was really easy because the back's able to do all the work. So what we're going to do for her to train her to use how to separate hip things from back things is we are going to find the happy medium. We're going to find her Goldilocks zone. That's not too hard, not too easy, just right. So she slides this leg back again, collapses down onto her forearms, and if she tries to lift her hip from here, bring it back down, she can do it from this position. So we're going to make it a little bit more challenging. So we're going to close down the angle between her thigh and her chest. So we're going to slide her back about 6 inches. So the foot's going to come back, the arms are going to come back, and she's going to try to lift the leg from there. And starting to get a lot more challenging for her. So right here is probably her sweet spot, because if we went a little bit lower and she tries to lift, she can't quite do it. So we're going to find that sweet spot where she can just barely lift, and we are going to do some exercises from this specific angle. And as she does that, she will get stronger and stronger and stronger. She'll eventually be able to collapse lower and lower and lower. And when she has the ability to lift that leg up off the ground while her chest is touching her thigh, that ensures that she has the ability to extend her hips through the full range of motion, and we'll start to see that transfer into our more traditional hip extension exercises. So it's really common that people will use some type of glute isolation exercise as an accessory exercise for their big lifts, for their squats and their deadlifts. But as you can see, if she is hip extending and her back is doing all the work, she isn't actually training the muscle that she does in fact want to be training. So we're going to use this exercise in place of some of our more traditional hip extension, kickback type things, and make sure that they are way more focused on the muscles that we do actually want to train. So we are going to do a set of 15 reps here. So we're going to collapse her down. She's going to slide back. So we found this is her Goldilocks zone, and we may need to change that a little bit within the rep. If we start too easy, we'll collapse her down. If we start too hard, we'll bring her the right way. So from here, I'm going to have you lift this leg. Good. And rep number 2. Perfect. And you can see that in this position, her back isn't really able to help and assist as much. Now, it can be very common that she will feel some tension on the opposite leg, and that is necessary to help stabilize the pelvis and stabilize the back in the right place. So for some of you, you might feel that this leg is actually working a little bit harder than this one. That is totally fine, and it is pretty typical in this exercise. So where are we at, Coach?
This is 14.
And one more, and perfect. And slide the leg in. Perfect. So we can use this exercise in place of some of our more common, more traditional hip extension exercise, some of our isolation type things, and absolutely ensure that we are training the things that we do want to train. Hey guys, thanks for watching. I hope you enjoyed this video and you learned some new things about the hips and getting them to function better. Make sure you click the like and subscribe button, and make sure you check out the pinned comment below for the Bodyweight Beats program. Again, I'm Dr. Moses Bernard, and I hope to see you guys next time.